best way to teach other providers the principles of CTR, cognitive therapy recovery?
I think there are a variety of methods, but one of the methods is actually the role plays. And I think there's nothing like seeing something actually going on. And so you'll see from the role plays that I'll do today that they might be instructive as to how you go about it.
I agree. I think role plays are really important. There's a group that we work with up in Massachusetts, and they've solely trained their direct care staff by using role plays in their supervision sessions. Because talking about it's one thing, but being able to practice. Some of what we've even done here, I hope, practice on how to actually do it is just a world of difference and makes you feel much more capable.
One of the things we were talking about a little while ago was, especially in order to change the culture of the places where you might work, is to get staff members to interview, to talk to the patients, the individuals with schizophrenia, and find out what their experiences have been in treatment. And that may give them a lot of empathy. We also talked about making sure that the staffs have training in trauma so that they can understand and help clients make sense of their experiences, that once they can see the link between the trauma and some of their current experiences, they feel that they understand themselves better and that the staff understands them better.
So to give an example of that, so there's a woman patient who witnessed both her parents being shot by somebody. She was in the same room, and the gunman came into the room and shot the parents and then left. And she was very traumatized by that. And the staff had similar experiences, either not identical, obviously, but they had heard of cases like that, and they themselves had experienced trauma, and so they were able to empathize with her. But the crucial thing was not in reenacting the traumatic situation, but what was it that she, quote, learned from the situation? That outsiders are dangerous and that they could shoot you up at any time. And that was what she learned, and this thing came out in the form of a delusion where people were robots all around and they were armed with guns and so on. And so this then established empathy with this patient, and her belief then is that she is vulnerable, and that was then the taking off point for the therapy, is to show her that she could do things and that she was safe and that people were not dangerous.